record this session. So I started recording, if it is okay, hopefully. If you if there is any problem with the YouTube, I can provide you with the link, and then you can just watch the video through the YouTube. Okay, so let's talk about our programs. And I was just thinking, because I was not sure that this is a face-to-face or probably even 2 weeks, 3 weeks ago. So I was thinking maybe we can share some experience in terms of why, or some views actually, why did you choose to study public health? Why public health at Flinders University specifically? And what do you expect to achieve? So I try to answer these 3 questions. Why public health? And I will talk about also, I will talk about some sort of career opportunities for public health graduates, as well as why Flinders University. So I will briefly talk about our vision, our teaching philosophy, and what do you expect to achieve in terms of some key learning outcomes, which can help you find a good public health good job within the public health area, hopefully. So let's start with a kind of big picture, which is public health at Flinders. So I want to highlight that as a postgrad public health student, you are now a member of an academic discipline, so which is discipline of public health, or group of or public health group, or population health group. So definitely we will pay attention on anything about how we can improve your experience as a student, also how we can improve your skills and knowledge in public health. And definitely, as a program coordinator, if you have any questions or any concerns or any misunderstanding, as I said a few minutes ago, I would be more than happy to set up online meeting with you, individually meet you, and if situation allows, even face-to-face meeting. So that's from my side. And I think that's a kind of environment that we are promoting at Flinders University, because we really think that you are a member of our discipline as a postgrad student, and the possibility of admission, PhD, and other teaching programs within our discipline. So definitely, we want to hear from you in terms of any feedback, any concern, any questions. So that's a promise. That's a part of our teaching environment and teaching philosophy. At Flinders University, we have 6 colleges. I think it's good to just have a very broad view of kind of what sort of academic disciplines we have at Flinders, or colleges we have. So 6 colleges: College of Business, Education, Humanities, Nursing, and Science, and finally College of Medicine and Public Health. So within College of Medicine and Public Health, we provide a range of clinical and health-related teaching, research, and teaching programs, both, because most of our staff have balanced position, which means a mix of research and teaching experience, which is really good, because they can, when we do research, then we can use the finding of our recent research within our teaching programs, and that's really good, because you can be familiar with the type of research which are common in public health, as well as some new findings. So this research teaching nexus and connection between research and teaching is something that, again, we really promote within our college and especially within our public health teaching programs. So the College of Medicine and Public Health provides a range of teaching programs, including medicine, CBT, cognitive behavior therapy, biotechnology, and paramedic science, and public health, with a couple of other minor teaching programs and short courses. So public health is part of teaching programs and research programs within the College of Medicine and Public Health at Flinders. In terms of our team, these are just a few of or key, I can say, key teaching staff with over the next few months or the next couple of years, you probably you meet some of them, not if not all. So these are really recognized public health experts, especially working at some specific areas like here I said SDH, which is social determinant of health, First Nation health and well-being, especially in terms of cancer. We have a range of expertise, experts in cancer prevention, cancer screening, epidemiology of cancer, as well as infectious disease, and lots of our topics now. Within our topics, we will talk about COVID-19 as well, different areas related to COVID-19. Let me just, yeah, I think that's better. And then next one is health economics, another area, which is my area, and biostat and epidemiology, definitely. So here I mentioned they are all willing, and this is really a promise. They are really willing to share their expertise and experience to help you learn and push the boundaries of your capabilities and knowledge, especially in terms of your practical skills. That's another area that we focus on. We need to improve your practical knowledge as well as practical skills. So from left, Courtney is topic coordinator for a couple of topics, including practicum, public health, and industry placement, as well as First Nations health and well-being. Then we have Andrea, who is coordinator for one of our key topics, which is social determinant of health. And we have Sadia with expertise, extensive expertise in epidemiology, Shahid with expertise in biostat, and these are, as you know, these are core topics. So especially for students enrolled in MPH, they have to complete these topics. Annie, who is expert in leadership and public health policy and global health. Andrea with expertise in chronic condition management. So we have, as you may know, we have a couple of 2 or 3, I think this year is two topics in chronic condition management, like diabetes, especially with a focus on public health issues. We have Lee with extensive expertise in qualitative research methods as one of the key area, key research methods in public health. And then we have Richard, professor in epidemiology and biostat. Again, he's coordinator for our, in collaboration with Sadia, he is coordinator for EPI topic, epidemiology, as well as some advanced topics in biostat like machine learning. And we have Annabelle, again, with expertise in qualitative research methods, as well as expertise in health promotion, which is another important area within public health. And then I think I talked about myself. So in here I'm provided some, just a link where you can find staff contact information if you need to contact them. as well as some study guide for each topic. Now, I think it's better just to briefly talk about public health at Flinders and focusing on teaching programs. So we have a key aim or objective to achieve, which is within our postgrad teaching program, which is about improving, as I said, probably a couple of times now, it's about improving your knowledge and especially practical skills. And again, I think this practical skills is really important, because that makes you different from other people when you, I don't know, when you apply for a job, or when you apply for even you know, different another teaching programs, or even PhD at some point of time, because I talk about our programs and how there is a transition from our MPH program to PhD. I will talk about this. And within the, so that's your individual, our student-centered objective. But our ultimate aim as a discipline of public health, or as public health expert, is by training you as a public health practitioner, making sure that you understand the key area of public health. The ultimate aim is to improve population health while understanding the principles of equity. Because sometimes when we talk about how we can maximize population health, sometimes there is a trade-off between maximizing population health and equity. So this sort of both important, I mean, improving population health, as well as improving equity. But I think you need to understand that sometimes there is a trade-off between these two key public health concepts. So within our teaching programs, especially within our core topics, we definitely talk about this, and we hope that at the end of your program, you understand equity, and of course at the master level, as well as you understand how to improve or maximize population health. And from my point of view, probably more importantly, what's the trade-off between equity and population health? So that's something that we really focus on. So that, I think this slide gives you a broad picture of what we are trying to achieve in terms of learning outcomes for our teaching programs. And here I provided again a couple of links. So definitely I upload this slide, this presentation on public health course site. I will show you public health course site. As well as I think I can ask our admin people to upload this. I don't know where, but definitely they will let you know. Probably within this orientation website, orientation or OVIC website, definitely they will provide the link to this presentation. So you can just quickly look at these two links where we just provide some sort of brief description of learning outcomes and some sort of brief description of each program, especially in terms of program structure and topic description. So that's two links are really important to review. At the beginning of my presentation, I talked about the Flinders approach, and again, I would like to highlight this because it's really Flinders approach. This is the environment, teaching environment that we promote. So, or teaching philosophy, because I think every topic coordinator as individual, and I as a course coordinator or program coordinator, we need to think about our teaching philosophy in any university. I'm not just talking about Flinders, but at Flinders we have a very clear teaching philosophy, which is student-centered learning. So that's really important. And again, as I said, if you have any concern about this approach, and you think that this is not something that you are getting from the topic, definitely you can in the first instance talk with your topic coordinator. They are very nice in terms of communicating with students and with you. And in the second step, if you are not 100% satisfied, you can just send me an email and we can discuss any concerns. But in general, we really think about how we can actively engage students in our teaching programs. And to be honest, in many topics over the past couple of years, we revised the topic structure, the topic content based on student feedback. And that's how it should work. So it's a kind of developing teaching materials in consultation with the end user, the key user of those materials, which are you, I mean, in terms of students. So again, back to my point. So feedback, student feedback is really, really important. So if you, and at the end of each semester, you receive a link in order to provide your feedback. And we ask you to provide your feedback in terms of what's in terms of the content of topics, or even the assessment activities, or the feedback that you receive. So it's really important to give us your idea, because it definitely has impact on the way that we revise or design, revise the existing topics or design new topics. As you know, we also have this online delivery option, which provides flexible study options. I know some of you prefer to have these face-to-face sessions, at least some face-to-face sessions within the topic, which is completely understandable. So we this semester, given the current situation, if nothing, or we don't have hopefully significant changes in the situation, then for each topic we will have some sort of, for most topics, we will have some sort of face-to-face sessions. So definitely through your topic coordinator will make announcement about the date and time of those tutorial or practical session. At this stage, we decided, given the situation, we decided to have almost all lectures online, but we can have this some tutorial session as a face-to-face. We can deliver as a face-to-face session. And then, of course, for those who enrolled as an online option or face-to-face but cannot attend our face-to-face session, definitely there is an online option as well. So there shouldn't be any problem for those who do not prefer or who do not attend for any reason. Or we have some students actually living in interstate, actually living in different states. So that's all fine. So making sure that you receive all key teaching materials and information through online delivery. And I think that's really important. Again, an important aspect of our program. This is mainly about MPH, of course. When you have a choice to select 3 streams as a capstone topics, because again, we think capstone topic is really important, because you need to apply all the knowledge that you learn over the past couple of years, or past 1.5 years or 1 year, how to apply your knowledge learned in the program to real world projects. So that's why we, at the end of your program, MPH program, again, you have, we offer 3 streams. One is public health project, which is a kind of, you can just work on a specific project with your coordinate, definitely your coordinator, Dr. Courtney, either can provide all instructions. The second choice or stream that you can choose, and I said subject to availability, because definitely we need to make sure that we have available places, is industry placement opportunities. So that's for the first time at Flinders. We can actively provide this sort of industry placement, and there are lots of placement who are interested to offer some sort of industry who are interested to provide placement for our MPH students, like Cancer Council, like Diabetes SA, excuse me, and SA Health as well. So you need to, and there is a kind of step-by-step process. So you have to talk with topic coordinator, Dr. Courtney Ryder, and of course it comes towards the end of your program. And another stream that we can offer or option is research pathway, which is public health dissertation. So if you are really think that you are interested in research pathway, or you are thinking about PhD after your MPH, that's the way that you need to, that's the topic that you need to complete. So it's a small scale research project. And then again, you can talk with me because I'm also coordinator for this topic as well. So then we can discuss what's your interest. And of course, we also look at your GPA, your performance, and I will talk because that's a really serious pathway. So you have to be interested in this pathway, and you should have a clear idea what's next after this. So it can be done in 6 months or can be done in 1 year. Again, it's up to you. We can discuss this toward the end of your program. So remember, that's just these 3 choices that you can have for MPH students toward the end of the program. A little bit about, now of course, I can't talk about specific topic or individual topics, but in general, our core topics within our programs. Again, I highlighted practical skills in public health key areas. As I said, practical skills is something that we really care about. First of all, core topics are designed within our public health teaching program to cover the first area, which is how to identify a health problem. So you have to start to understand how you can identify, how you can specify what is the health problem and how you can identify, because that's the first step to solve a problem or fix a problem. You have to understand how you can identify the problem and the factors influencing health problems. Topics like social determinant of health, First Nations health and well-being, even critical perspective on global health. These sort of topics can provide you with some sort of knowledge and practical skills to identify health problem. The second step is, now you identified the problem, how to develop a solution to fix the problem. Again, we have a range of topics which gives you or provides you with knowledge and practical skills of critical analysis of existing policies. Maybe the current or existing policies do not work or evidence doesn't work. So then you have to have this sort of skills to analyze existing policies. Or we have other topics which is talking about principles of research methods in public health to generate new evidence. So both existing evidence, reviewing or critical analysis of existing evidence, as well as generating new evidence, like a range of quantitative, qualitative, and mixed method topics. Also, you need to know how to evaluate an existing health intervention in terms of acceptability, effectiveness, and for those who are interested in economic evaluation, cost effectiveness, which is an emerging area within public health. For example, how to evaluate the cost and effects of colorectal cancer screening programs. So that informs decisions made by policymakers. As well as leadership in public health. So that's 4 key areas, public health areas, that are core topics collectively trying to cover. We have also a range of option topics, a broad range of option topics. So we have some sort as an option topic, advanced topic in public health, like biostat. From this year, we have in 2022, we have also machine learning, which is again a kind of advanced topic in biostat, different area, but again, for some of you with basic knowledge of biostat, or definitely that would be really good to push this boundary and expand their knowledge in terms of biostat. We also, within our option topics, as you can see, we can have we have public health nutrition as an option topic, or community nutrition, a couple of topics about aged care, chronic condition management, as I said, environmental health, health ethics, and digital health, which is again the new topic this year as an option topic. So as you can see, and I said some options topic may not be available, but definitely digital health, machine learning, health ethics, environmental health. And if you see any other topic within our university, in other colleges, or in other programs that you can justify why it is important to complete that topic, again, I'm really open to this sort of discussion. So you can send me the details. Again, we can meet and discuss your specific need. So my point is that I'm quite, or our public health discipline, we are quite open. The aim is to make sure that you learn, you get what you need. So that's why I'm very open to any other topics that if you can justify why it is important for your future career, definitely I'm happy to consider this. Also a range of teamwork and communication skills across different topics. So communication skills is another area that we focus on, and lots of our topics actually provide this sort of knowledge and skills, especially practical skills in terms of communication. We have some sort of project, a team-based project, for example, which promotes how you can work with other members of team, which is in real world is happening. There will be some challenges, which is a part of learning process actually. So that's why I think we also need to, within our program, we also focus on communication skills and teamwork. Some presentation in some topics, we have oral presentation, for example, for public health dissertation. One of the key assessment activities or tasks is to present in 30 minutes or half an hour, like very professionally. I mean, in terms of like a PhD presentation, you have to present your findings, your literature review, and then we have some examiners to ask you questions. These are really, really important. So don't worry about this. This is a part of learning process that you need to learn. So my point is that this sort of teaching programs trying to equip you with all these essential skills that you need for your career, public health career. Within postgraduate public health teaching programs, we offer 3 awards. So Master of Public Health, as I said, 2 years and 1.5 years, 72 or 54 units, and then graduate certificate in public health and health promotion. As I think I mentioned, most topics are 4.5 unit topics. And sorry, graduate certificate is in 18 units, as you know, 18 units program. And for each topic, we have a study guide and lots of instructions that you can find, including timetable, assessment tasks, you can find within their specific flow site. And full-time students can, as you know, can normally complete 18 units of study in a single semester. So I'm against any overload more than 18 units. It should be a really, really good justification why you need to do more than 18 units. Usually I don't approve, and because that's definitely impacts the quality of teaching and learning as well. So I think for full-time students, 18 units of study is maximum that we can approve and accept. Another good thing about Flinders program is a kind of connection between different grades and different programs. So if you do your graduate certificate, then you need to, the way that we structure graduate certificate is that you need to do at least 2 core topics within MPH. So if you finish your graduate certificate, at least you already done 2 core topics within our MPH program. So in any cases that, for example, in a couple of years, you decided to get back to a study and do your MPH, then it would be easy to do this. So we have some sort of easy process to transfer your credits, especially when you do your graduate certificate within our university. Also for those, but we understand for some students it's not possible to finish their MPH for different reasons, including personal reasons, or they find job somewhere else. So that's fine. So we designed this exit award for MPH students. So if within your MPH study, you've done 36 units, and of course we look at the type of topic that you have done. If you finish 36 units, there is a possibility of this exit award, which is graduate diploma in public health. So technically we have all graduate certificate, graduate diploma, and MPH. And as I didn't mention here, but if you choose, as an MPH student, if you choose research pathway, the stream that I just discussed, public health dissertation, there is a possibility of transition to PhD. So in any way we can transit your study in terms of which way you prefer. So again, if you have any question about this, although I know it's a little bit early at this stage, but I'm more than happy to discuss your study plans even for next year. This one would be a kind of structure for 2 years, and definitely you can find in public health course side, but that's just a brief description of core topics. This is a 2-year program. And of course, as I said, within the core topics, we try to cover the key public health area and major topic or capstone topic. As I said, practicum in public health. We offer 2 streams. One is public health project. Another one is industry placement within PHCA 9509. And then if you have you are interested in public health dissertation, then that's another option that you can choose in consultation with myself, of course. And this is for 1.5 years, and of course that would be 54 units, recognizing your prior knowledge in terms of having a bachelor or undergrad degree in a health-related field. But again, we have this sort of capstone options, 3 streams that you can choose from, with a range of option topics. So again, we are trying to make sure that we cover within the core topics, we cover the most important. Of course, I can't say that we are covering all public health areas, because public health is very, very broad, as we know. It's getting broader and broader. But we try to make sure that within 54 units program, we try to make sure that we cover the key public health areas. Graduate certificates structure for those who enrolled in this program, it's only 6 months, 18 units, and this is the structure for graduate certificate in public health. So core topic is social determinant of health and well-being. Given that we, I think that's a really, really important topic within our programs, public health programs in general, social determinant of health, and we have several experts in social determinant of health and well-being, plus 4.5 units from this list to make sure that you, back to my previous point, make sure that you at least complete 2 core topics if you want to, for example, enroll in MPH in a couple of years, for example. Graduate certificate in health promotion, again, social determinant of health is one of the core topic, as well as health promotion, as we expect. And this is again a study plan. Again, within the public health course site, you can find this study plan. That's a recommended study plan. So you can choose differently, but please make sure that you understand which topics, because we can't, not just us, I think other universities have the same thing. We can't offer our topics in both semesters. So some of our topics are delivered just for example, first semester or second semester. So when you choose your core topics and option topics, you have to make sure that what's your plan for the next, especially for MPH student, not a big problem for graduate certificate students, especially when they start at in first semester. But for MPH students, you should think about your plan for 2 years or for 1.5 years. It's not just looking at 6 months plan, because it may have impact on your the choice of your topic. And then you have, and I have had this student that who completed lots of topics, almost all topics, and one core topic left, and he didn't think about this, because this core topic, we delivered this topic only during the first semester, and that was June or July, so he couldn't finish his program because he couldn't finish core topic. So again, that's all core topics. So that's really important to think in advance. And again, I'm more than happy to provide all information if you need. A little bit about career. Little bit about career. So I provide the name of some, not all, potential employers like Department of Health, SA Health, for example, Primary Health Network, PHN, Cancer Council, Research Institute Centers, or Center Diabetes Australia Heart. So this is a kind of some sort of private or non-government health-related potential employers, aged care centers, and universities. And this is the list of, again, potential occupations, like public health officer in terms of program development, program evaluation, especially when we have an option topic of evaluation topic, public health project manager, health data officer, health promotion officer, especially for those who enroll in graduate certificate in health promotion, clinical study coordinator. We have lots of students with this sort of skills in health clinical trials, epidemiologists, health protection and safety manager, research. So that's, and finally I mentioned future study like PhD, especially when you do your public health dissertation, which makes you eligible for PhD. Again, if you have any question about this, you can just send me an email. We can discuss in more details. One more thing, which is about academic integrity. That's a key value at Flinders University, which is a commitment to principles of honesty, respect, trust, and fairness. And I said taken very seriously, and this is really very, because that's really important for us. So I can't provide lots of details about this, but please visit this website. You can find, especially for some international students, and the reason is that because of different education system, and that's completely fine. Different countries have different, no judgment. Different countries have different education system. But when you decided to come here and do your study here, I think you need, that's your responsibility, to know the rules, to know the principles, and respectfully follow those rules and principles. So that's really important. So we can't accept that I didn't know that this is not really acceptable, and especially for postgrad student. So please look at this website if you have any question. We have academic integrity officer. That's why I said it's really important, because we have nominated officer for academic integrity within public health. So then again, you can discuss all the misunderstanding, or if it is not clear, we can discuss with her. And I'm quite sure, hopefully you have, you know about Compass and this link that you can visit. You can find all information about Flow, student system, your email, your student ID, FAN, everything that you need. And again, I encourage you to go through all the things that you need as a student in terms of, as I said, student ID and FAN. And this website provides you with a range of support and information and services. Another important information that you can get within our program is Postgrad Public Health course site 2022. So please make sure that you have access within your flow. When you open your flow with topics that you enrolled in, you should have also access to Postgrad Public Health course site 2022. Because within this flow site, I frequently make an announcement and provide some update about the course, about the postgrad, including graduate certificate and MPH. So please make sure that you have access to this. If you don't, you can send me an email and then I can direct you to the right person in terms of access to this flow site. And I think that's just for you to have a quick look at the links for critical enrollment dates, semester dates, and flow help, especially if you are not familiar with flow, which is completely fine. But you need to learn how to work with flow and make sure that you understand flow, because everything will, in terms of information for each topic, will be provided through flow. So you need to make sure that you understand. So that website or that link can help you to understand this. Or if you still need some support or even one-to-one meeting with somebody, with flow expert, then you can find a contact person here. So I want us to make sure that you understand these are all the enrollment side of your program. I'm coordinator for the content side of your program, study plan. So if you have any problem in terms of enrollment, in terms of flow support and this sort of thing, you need to visit these websites. And please don't send me an email because I can't help you. My role is something different. And again, some more support and services that you can find within this. As I said, I upload this slides and presentation, so you can have all this information if you need. And finally, again, I think I just mentioned this. So if you need course advice, and I said content, structure, and study plan, you need to contact me. But if you have any question about enrollment, flow questions, credit transfer, leave request, or you don't have access to this flow, for example, for this topic, you need to contact at first instance, ask Flinders. And if they can't answer your question, then definitely they direct you to a right person. And this is my last slide, which is a student rep. I definitely think that is really important to have a student rep which represents your voice, student voice, in terms of MPH and graduate certificate. So short, and it's really important because as a course rep, you are a member of the Board of Education, College Education, which is the main decision-making body within this department or discipline or college. So that's really important that we can have your voice within our decision-making bodies. So shortly, I will send through the course website, the public health course website, I will send all students expression of interest form. And then if you can for those who are interested, you can fill the form and then send it back to me. And then we can discuss, which is a really good opportunity. I think it's really good for your CV as well. And over the past few years, I've been working with excellent student rep, which is really good. Okay, so that's from me. So let me just stop sharing. Okay, so I hope that it was useful. I can see around 30 students attended, which is really good. And again, I do apologize for delay that we had and some sort of misunderstanding in terms of access to chats, but definitely, if you have any question, and if it is not clear, I would recommend just look at the slides again, and definitely you can just rewatch this presentation again in a couple of days, or probably mid next week when they put it somewhere, and definitely we will let you know. And then if you have questions, you are not clear, especially in terms of your content of your program, study plan, or structure, especially a study plan. Again, I repeat this because that's important, especially for MPH student over the next couple of years. Then you can please ask any question. Thank you again, and hopefully I can see you. I'm not sure that, Miles, you can ask a question because I can't hear you. Probably, I think we discussed this, but the problem is what I can do is, just give me 1 second. For those who have just give me just 1 second. For those who have any question, I can provide you with this. Okay. Can you see the chat section? I provided you with a link, another link, Collaborate link, but because I manage this link, so probably I can have this sort of permission to give you any types of chat or talking or asking any question. So for those who want to ask any question, can you just click this link, and then I can answer your questions. Is that okay? All right. Okay, thank you.